morning. I'm going to talk to you about a patient who came to me a few years ago. Let's call her Sheila. So Sheila was well until she became sweet 16. And at 16, something strange happened. She actually became sweet. Yes, she developed the signs and symptoms of diabetes. She went to a local physician who, based on her young age of onset and the fact that she was lean, diagnosed her to have type 1 diabetes, also known as insulin-dependent diabetes mellitus. Now, you may know that once you are diagnosed to have type 1 diabetes, Sheila will have to take insulin injections not once, twice, or thrice, but 4 times a day, lifelong, if she has to maintain life and good health. Naturally, Sheila was devastated, as was her family, and so she came to me for a second opinion to see whether anything can be done. I had a look at Sheila's records and was surprised to find that her mother had diabetes, as did her maternal grandfather and her maternal great-grandmother. So it is clear that the diabetes was running in the family 3 to 4 generations, which is a little strange for someone with type 1 diabetes. The next thing we did was to measure how much insulin Sheila was producing, and lo and behold, she was actually producing quite a bit of insulin, which militated against the diagnosis of type 1 diabetes. There are some other tests like the GAD antibody test, the zinc transporter test to confirm or to rule out type 1 diabetes. We did all of them and they all came out negative. I thought it therefore appropriate to look for other forms of diabetes, and there are monogenic forms of diabetes, by which we mean that there's a single gene defect, and this is the kind of diabetes which runs through families. So we ordered a test for Sheila, and thankfully it came out positive. So Sheila had a mutation which qualified for a type of diabetes called MODI, not M-O-D-I MODI, but M-O-D-Y MODI, which is maturity onset diabetes of the young. Having made the diagnosis, we took Sheila off her insulin injections completely, treated her with a very inexpensive sulfonylurea tablet to which she responded, and therefore Sheila did not need any insulin injections for the remaining 10 or 15 years since then, when she has been coming to me regularly. Many other family members in Sheila's family also turned out to have MODI, and they are all treated with tablets. Now, if you thought that that was dramatic, let me tell you about another child, a newborn baby in fact, who was diagnosed to have diabetes when she was 3 months old. Let's call her Priya. So Priya again was diagnosed to have diabetes at the age of 3 months. And again, when you get diabetes in childhood, immediately the first diagnosis which comes to mind is type 1 diabetes. But there is another form of diabetes which is present before 6 months of age. And this form of diabetes is called as neonatal diabetes. And if you think of neonatal diabetes, you order a genetic test. And if it turns out to be positive, if there are mutations in some of those genes, then children with neonatal diabetes can go off insulin. So we ordered it for Priya, and lo and behold, again, we found that she had a form of neonatal diabetes which responds to tablets. Priya was taken off insulin completely and treated with a very small dose of a tablet. To Priya and to her family and to hundreds of such young children who have undergone genetic testing, it was nothing short of a miracle. Let me ask you, in life, does one size fit all? Obviously not. Then why should the same treatment be given to everyone with diabetes? Ladies and gentlemen, today is the era of precision diabetes, by which we mean There are more than 20 or 25 types of diabetes, and it's our duty as a diabetologist to accurately pinpoint which type of diabetes that we have and give the appropriate treatment. In fact, we have developed a gene chip in collaboration with another company called MedGenome, and every patient in whom we suspect that there could be a monogenic form of diabetes, we do this genetic testing and change the patient from insulin to tablets. But let's talk about the more common form of diabetes, which is in epidemic proportions today, and that's type 2 diabetes, which occurs in adults, and you can treat this form of diabetes, thankfully, with diet, exercise, and, if needed, tablets. If you look at the population of various countries, today, China is in first place with 1.3 billion people. Not far behind is India with 1.2 billion, and the projection is that in the next 4 or 5 years, we'll actually exceed China. But if you took all the people with diabetes and put them into a country, in other words, if diabetes was a country, it will be the third largest country in the world, because currently there are 425 million people with diabetes in the world, and the United States is 300 million plus, so diabetes would actually be the third largest country. If we just talked about India, there are 72 million people with diabetes in India. That's more than the population of UK, more than the population of France, and 3 times the population of Australia. But diabetes is not all about statistics. It involves the lives of people like you and like me. And therefore, it is our duty that if somebody is diagnosed to have diabetes, to offer the specialized diabetes care to every person with diabetes in this country. Unfortunately, 70% of India's population lives in rural areas, while 70% of the doctors practice in urban areas. Due to this complete mismatch and other problems on the challenges associated with rural areas, which include illiteracy, poverty, lack of accessibility, and lack of specialized diabetes care, it is not easy to offer specialized diabetes care to our villages. Doctors are not willing to go to rural areas to serve the poor people there because of the lack of facilities and so on. So we have to think up of something different so that we can reach rural India and make the 6A test possible, that is to make diabetes care available, accessible, affordable, appropriate, acceptable, and accountable in rural India. So with this in mind, we took up what is now known as the famous Chunampet rural model for diabetes care. For those of you who don't know where Chunampet is about 120 kilometers south of Chennai, the 4th largest city in South India, and it's in Kanchipuram district. So why Chunampet? Because the owner of Chunampet, the Zamindar of Chunampet, actually called me and said, I'm willing to give you a piece of land if you can do something for my people. So I thought about it, how do I deliver diabetes care to villages in and around Chunampet? So the first thing we did was that we fabricated this van. It's verily a diabetes hospital on wheels. Inside it, we have all the equipments to screen for diabetes, to screen for the complications of diabetes, like the eye, the kidney, the heart, and so on and so forth. As you can see, there's also a satellite which is donated by the Indian Space Research Organization, or ISRO, and using that, you can actually communicate with people inside the van from hundreds of miles away. So what we then did was, we took people in these rural areas, and young men and women from Chunampet and adjoining villages were trained to check the blood pressures, to get informed consents, heights, weights, blood sugar, and so on. It's very easy to train these people to do these simple jobs. If it turns out that somebody has diabetes or hypertension, all we have to do is to take them to the van which is parked near their homes, and inside the van we can actually arrange for a complete examination of all the systems, including the eye, the kidneys, the heart, the feet, and so on. Images can be sent to our base hospital through satellite or through internet, and here is one of our ophthalmologists talking to the lady inside the van several hundred kilometers away, explaining to her what we did and what is diabetic retinopathy. We also set up the Sai Rural Center there, and that's one of our doctors from that area who provides the follow-up care. The results were dramatic and have been acclaimed. The Lancet wrote, and I read, "The Chunampet Rural Diabetes Project thus seems to be a good model for delivering preventive and therapeutic diabetes healthcare to rural areas." We also had recognition from the CNN, from Discovery Channel, from the Le Monde in France, the largest French newspaper, the BBC, the Business India, and this book, Jugaad, which means innovation in Hindi, had a whole chapter on the Chunampet model. So having done this, what is my take-home message to you? My message to you is that we should try to detect diabetes early, and you can do that actually using a simple risk score which we have developed called as the Indian Diabetes Risk Score. So to find out whether you're at high risk of diabetes or not, all you need is to know your age, whether your parents have diabetes, whether you exercise regularly, and then a simple waist measurement using a tailor's tape. If the waist is more than 90 centimeters in men and more than 80 centimeters in women, you are at high risk of getting diabetes. So if you are at high risk, the good news is that diabetes is preventable. And how do you do that? Ask people to walk 30 to 45 minutes a day, and most importantly, to cut down carbohydrate, which is the main culprit. So I was one of these such sessions where I was talking to people, and to tell them how much rice to take, I actually took this cup along with me, and I said, well, this is a cup of rice, and you can take 1 cup, 1.5 cups of rice, and so on. So a gentleman in the back at the end of the session asked me, "Doctor, you told me about these 2 cups of rice. Should I take it before food or after food?" So he had no idea that he thought it was some kind of medication I was telling him, and his food is different. So people have no idea how much food they should actually take. So if you just do that, cut down on your carbohydrates and walk and reduce weight, you can prevent diabetes. What about if you already have diabetes? Not to worry, we have shown in a major publication a couple of years ago that even people with diabetes can live 50, 60 or more years without any complication of diabetes. In other words, a full and healthy life is possible even if you have diabetes. And therefore, let's defeat diabetes. We can and we will. Thank you.